Hello massage nerds. Today I'm going to be bringing you abdominal massage. I did a survey on Instagram and I was really surprised at the response. I asked about how many people include abdominal massage in the routine and how many don't, and the responses were great. I thank you guys for that. However, I did learn a lot. I learned that the majority don't. They ask the client. So today I really want to talk about some of the benefits of abdominal massage. I'm going to talk to you about how to approach clients, how it affects the nervous system, the lymphatic system, the muscular system, and the digestive system. So I want you to keep in mind that we're not one-sided. You know, somebody mentioned that the front is, connected to the back, which it is. We all know that weak abdominal sometimes causes you low back pain. So if your abdominals are weak, it can also refer into the back. Another thing that we must, understand that's very important is that the lymphatic system, we have a lot of lymph nodes in our abdominal area, so it absorbs, it helps to push the lymph back into our cardiovascular system. And don't forget, the Peyer's patches are in the small intestine, so you have an effect on that. With breathing too, the diaphragm is, a muscle right here along the costals, right underneath the rib cage. So we also can affect that. That's very important because we affect the nervous system. Breathing is so important for relaxation. Cranial nerve number 10, the vagus nerve, comes out from in front of your ears and it wraps around your heart, your lungs, and your stomach. That is a parasympathetic nerve, which means rest and digest. So we affect that too. If we can stimulate the vagus nerve, then you get your client to relax. We also work on so many muscles, the rectus abdominis, the internal obliques, we can work on the diaphragm, we can work on the intercostals. People that have been coughing, especially nowadays, with the winter season, with a cold and the flu, they cough and their intercostals hurt. So it's very important for you to work these muscles out. We can affect the QL. I'm going to show you some techniques on how to work, all the way from the QL back, the psoas, the lats, the serratus anterior, my favorite muscle. So we do affect the muscular system. Those are just the benefits right there that I've given you, not even counting the digestive system. So now let's talk about the digestive system. Let's talk about how it helps with bloating, with digestion, with people that are constipated. I'm going to show you a couple of techniques to help people that are constipated. And also, just to show you why it's so important for you to incorporate it into your massage. I know that, for all the years that I've been teaching, I teach it as part of the routine. A lot of the comments that were left in the Instagram said, well, I asked my client if they want me to do abdominal massage. And this is how I would like to introduce to you, maybe this is how you can approach it, because this is how I've taught it. You make it part of your routine from the first day that your client comes in. When your client comes in, you've done the medical history, you've talked to them, and you give them a rundown. It takes you 1 minute to say, I'm going to be working your head, your neck, your shoulders, your arms, your legs, your back, and your abdomen. It's part of the routine. If you ask them, like, would you like for me to give you an abdominal massage? Then they're going to say, well, why are they asking me for that? They didn't ask me for they didn't need my permission to massage the legs. They didn't need my permission, So you make it kind of weird. It gets kind of weird when you ask the client permission to work the abdominals. If you just incorporate it, it'll be part of it from day one. Because it is just a body part. It's an important body part, especially if you explain to them and teach them why it's important. Now, if they tell you, you know what, I don't want you to work my abdomen today, that's a different story. They might even tell you, you know what, my low back, I've got some issues. I really don't think that, you should work on it. Give the client the option to tell you, no, after you've given them the whole body rundown on day one. It's so important. Like I said, you address so many issues with it. So I'm going to show you another thing that I want to talk about is the draping. You know, the female, you automatically drape them. And males, don't ask them, would you like for me to drape you? Because again, that's kind of strange. Males do not usually like to be draped. They're going to be exposed down to their waist, and that's okay. And also, you must have the legs relaxed. So it's best if they put their feet flat on the table or with a big enough pillow where the abdominals are relaxed. I've seen massages, abdominal massage, where the legs are flat. You do not want to do that because you want to make sure and relax the abdominals so you can get to the large intestine. So let's get to it. I'll show you some techniques right now. Okay, so now I'm going to show you some of the first techniques. As you can see, Miriam did an amazing job as usual. We've got the liver right here on the right upper quadrant, the stomach, and these are some of the obliques. And we've got the ascending, transverse, and descending colon. And then the small intestine is in the middle of that. So I'm going to show you the first thing you want to do is introduce your hands gently. You don't want to start working right away. So you might want to just warm up your hands a little bit and put it at the level of their navel and just hold it there and maybe do just a little bit of like waves right there. Just gently start getting stuff moving there. I'm going to show you the very basic technique that's called the sun and the moon. I'm sure all of you learned that in school. And that is where you just go around in a circle. And you're standing on the, right at the table in a horse stance, facing opposite. So this is the sun moon technique. All you're doing is in a gentle, introducing touch to your client, especially if they're in pain. They've had pain, so you want to just do the sun and moon circular clockwise motion. And let me explain to you why. Because you've got your ascending colon, your transverse colon, and your descending colon. People that are constipated, you usually feel it on their left side, which is the descending colon. You might be able to feel little tightness or bumps along the way, so be careful. So far, we're just doing the sun and moon circular motion. And if somebody is, they tell you they have been constipated, then you might want to just do this technique where you take 2 fingers and you may hold right underneath the rib cage. And with 2 fingers, just kind of drag 2 inches at a time, 1 inch or 2 inches at a time down. And this will really get the large intestine, the descending colon. Like I said, when people are constipated, they usually feel it on the left side, and you can feel it too. So just very gently all the way down, 1 inch or 2 inches at a time, just gliding down. And on this side, you would go up 2 inches or 1 inch at a time, just, and then transverse. And you still take the 2 fingers, and you might only do circles, little circles all the way around. And remember, it's always in a clockwise motion. You've got the gallbladder right here. This green one right here, this is your gallbladder. So be careful not to use too much pressure there. And go the transverse colon. All I'm doing is I'm lifting the hand and then putting the 2 fingers and then going in a circular motion. So lifting and doing small little circles all the way down. I actually feel something right there. So this is more specific where you can actually feel underneath your finger, the pads. Don't use your fingernails, use the pads of your fingers. All the way down, little circles, all the way around in a circular motion, in a clockwise motion. This might be a very sensitive area for people that are constipated, so go easy, go light. Remember, on the right side, you have your vermiform appendix, and you don't want to put too much pressure here. If they're constipated or anything like that, there's no need for you to put pressure here, right, on the right side where the appendix is at. So again, we're going to use the sun-moon technique just to kind of continue transitioning. This is just real gentle, real soft. And now I'm going to do the ocean waves, which is some wringing. I'm going all the way across the abdomen. Again, I'm in a horse stance, just going all the way across. Continue the circulation here, or I can do it right here also, just contralateral on her left side, just doing some wringing, some ocean waves. While I'm here, now I'm going to do some Petrissage. Oh, that feels good. She likes that. Yeah. I really, when you get this done, you just feel so good after. You feel like clean almost. Usually people pass gas. Don't be afraid if they pass gas. It's good. Or they might get up and have you to use the bathroom. So all of that is good. So you're doing here just some kneading, or some SIBOing. And if you can see, I'm even getting the obliques from here. Now I'm not just affecting the digestive system, but also the obliques, So let's talk about even the raking. I'm going to go here and rake in between the intercostals here. And you always want to make sure and have it tucked in here. By the armpits, right around here, you want to tuck it in. And also right here at the ASIS, you want to tuck it in, especially if they're wearing underclothes, then you just tuck it in right there. But the raking, you just make a rake with your fingers and go in between the intercostals. You're getting the Serratus anterior, you're getting the lat. If you go all the way back, you're getting the lat, the Quadratus Lumborum, and coming down here to the external obliques all around the iliac crest right here. So this is a great one to just really get things moving here. You're working on the muscles. And of course, you're going to do both sides. You're going to switch to the other side and do both sides. Another one that you can do if your table's low enough and you're tall enough, I'm going to put my hands right in the middle of her back and just lift up. Go to the middle and lift up. And then the muscles start relaxing and they start, moving around. This can also create some movement for the abdominals. Don't forget that if you have weak abdominals, it will give you some pain in the back. Another, let's talk about the lymphatic system. We have a lot of lymph nodes in our abdominal cavity, and the Peyer's patches are right here in the middle. So every time that we're even a gentle sun and move technique will get the lymphatic system going, which will move the lymph back up to the draining up here under the subclavian, under the clavicle to the subclavian veins, to drain it back into our cardiovascular system. So it affects the lymphatic system. And let's talk now about the nervous system. The vagus nerve. The vagus nerve, as I told you in the introduction, it comes down and it wraps around our heart, our lungs, and our digestive system. So anytime that you can affect the vagus nerve, which is for rest and digest, it's a parasympathetic nerve, this is fantastic. So one of the things that you can do is go right along the rib cage right here. I didn't want to put too much oil because I didn't want to mess up the paint. So now I'm going to talk about the diaphragm. The diaphragm goes across right here, all the way across. This is for breathing. Breathing, deep breathing, And don't offend your clients. Don't make them feel bad if they don't know how to breathe with their belly. Most of us really breathe up here. You know, we don't engage our belly. And it's really best if you do. If you watch a baby breathing, they engage their belly. They haven't learned bad ways of breathing. So you want to make sure and ask your client to breathe. She's breathing with her belly now. And ask them to take a deep breath. And on the exhale, you're going to work the diaphragm. So take a deep breath, and you're going to get your fingers right here, right under the rib cage, and then on the exhale, you go out. Okay, again, take a deep breath, and on the exhale, perfect. You want to come down the diaphragm right here, all around the rib cage. If people have asthma or they've been coughing, you've got to work the intercostal muscles really very specifically here, where you just take your finger pads and work each of the intercostals. Another one for the diaphragm is when you're going to go right below the rib cage. Watch out for the xiphoid process. The xiphoid process is the pointy part of your sternum. So that's a landmark. You're going to make a triangle from the xiphoid process to the ASIS, across to the other ASIS, and then back up here. So make sure that that you're not putting too much pressure on the xiphoid process. But one of the things that you can do is ask your client to take a deep breath, and on the exhale, you're going to pull down right here along the rib cage right here. That feels good. And this is for the diaphragm. You're kind of releasing the diaphragm. Okay, take a deep breath again. And exhale. And just pull down right here along the rib cage. And of course on this side, take a deep breath. And exhale. And be careful, the liver's right here. You're also stimulating not just the diaphragm, which goes across here. The diaphragm is a dome-shaped muscle, which is right here like a dome. So you want to make sure and pull it down, but also be careful with the liver. Don't go too deep. Or on this side is the gallbladder too. So you can do coming down from the xiphoid process, coming down the rib cage. You can do the intercostals. You can do the raking down with with the two fingers, or this way, the sun and moon technique. And also, you want to start right here and then go up and out. You can also do it with your thumbs, up and out. Up to the xiphoid process right below it and out. Up and out. And then the kneading. And then the kneading from this side. And if you want to go to the opposite side, you don't want to lose contact with your client, so you can go from here to the shoulder, to the other shoulder, and then go to all the way around to the other side. So you want to end with giving them a little bit of energy and just a little bit of rocking again. And if they have problems with digestion, then you might want to spend a little bit more time doing more of the sun and moon, and then more of the 2-finger, 1-inch, 2-inch stripping down. So I hope that helps you, that you learned that it affects the nervous system, the lymphatic system, the digestive system, and the muscular system. So I hope that this gives you enough information that you can help your clients feel better, and that you incorporate it from the very beginning, that you incorporate it into your massage. So until the next time, create a great day.